Hi, Dr. Chivers. How are you today?
Good. How are you?
Good. I think you were going to talk to me about a lady that came in, a patient that came in who had some problem with her knee and pain, and the doctors weren't able to resolve it.
Yeah, we saw an older lady this week that had come into the office with a primary complaint of medial and anterior knee pain, and she'd been to the doctor who had really just kind of said, "You're getting old, and it's not, not surgery worthy. Take ibuprofen and, go away." And so she kind of did that, and that wasn't working for her. So she went back in, and they wrapped it and then sent her to a podiatrist, and then they gave her a cortisone injection to try and eliminate some swelling, and they gave her custom orthotics, and none of it was really helping. And we'd helped her years ago, actually, with some neck and headache problems, and she popped in and said, is there anything you could do for us? And we said, well, come on in, we can take a look and see if it's more your low back or if anything's going on. So we saw that her pelvis was actually tilted, and she had definitely some low back issues. So we started working on her low back, and there was definitely swelling on the knee. So we started doing the kinesio taping on her knee and some cold laser. And from having been in pain for well over a year and not getting anywhere, it took about, today when I saw her, I think was her 8th visit, and she is now back able to walk up and down the stairs and is back to training for a 5K run at the end of this month versus,
really?
Being in pain constantly and not even being able to do her job. So you really have to sometimes make sure you've had everything looked at and considered rather than just listening to the first, "You're getting old."
Yeah. Or it's your knee and it isn't.
Yes, or it's your knee and it isn't. If they can't find anything wrong with your knee, but you're having pain, don't let somebody tell you that there's nothing wrong and it's kind of all in your head.
Right. I myself personally, I think, I've had knee pains off and on a number of times through the years, but I think only once was when I fell that it was actually the knee. It was always been something going on, with my hip, or I was out, or a number of other things. So I think that's a very important point for people to understand, that they immediately want to, well, I don't mean to be critical, but we do, we're so, let's take a pain medicine or pain relief or anything to just get rid of the pain, and sometimes it's just as easy as something very simple like this.
Right, it is, and the big problem with taking the painkillers and just covering up the pain is if it actually happens to be your knee, and all you do is cover up the pain, all you're doing is making it worse and worse and worse. Pain is your body's signal saying, "Stop what you're doing. Something is wrong here."
Yeah.
So, I do not understand why sometimes people, just. I am not against taking ibuprofen, but there is a time and a place for it. It is not something you're supposed to live on for for everything.
Well, I know people like you, of course, chiropractor, and people like me that doesn't take pain medication. We might think we don't understand, but we're being fed this all the time. See advertisements all the time, and even in the face of, I'm such a good example for people sometimes, because I'll tell them, for example, last week, for example, I got up and I don't know what had happened, But every time I put my foot down, I had this excruciating pain in my knee, you know. And then so I did some of the different things that I use, Feldenkrais and some other things, and I did that just a little bit. And whatever was going on just worked itself out, and the pain was gone. And I hadn't even thought about it till now. So there's so many things that we can do, and I'm hoping that as people listen to us, I mean, besides going to a chiropractor, but, I mean, that's probably, if people don't know any of these things, that's the place to go, right?
Right off if they're at home and they don't want to go see anybody and they think the swelling's causing the problem. They've just completed a new study that says if you take, it's 2,200 milligrams of fish oil and flaxseed oil so that you get all your omega-3 oils. 2,200 milligrams a day has the same equivalent of anti-inflammatory properties in your body as 1,600 milligrams of ibuprofen a day.
Really?
So
wow.
Right off the top, you can have a massive anti-inflammatory effect on yourself if you start taking those things. And, they also help with brain function rather than killing your liver and your stomach.
Right. Well, that's great. I'm glad we had a chance to talk about that today, and I hope you have a good rest of the day, and let's see what we're going to talk about next week.
Yeah, sounds good. Can't wait to do it.
Okay.
Did that sound